Selamat datang saya ucapkan kepada peserta dan terima kasih kerana sudi menyertai program webinar ini. Okey, hari ini kita bersiaran secara live melalui FB, Facebook Hospital Putrajaya dan YouTube channel UPSK Hospital Putrajaya. Okay. Saya Zunaidah Tohari, pegawai psikologi kaunseling Klinik Kesihatan Petani Bahagia. Dan hari ini kita akan bersiaran langsung dan webinar kali ini Thursday Talk siri ke-13 anjuran unit psikologi kaunseling Hospital Putrajaya yang bertajuk Creating a Healing Space Integrating Trauma-Informed Practice into Daily Care. Okay. Sebentar tu kita tunggu yang lain untuk masuk ya. Okey, tanpa membuang masa kita menjemput Dr. Hero untuk sebagai tetamu undangan hari ini untuk masuk. Hai, selamat sejahtera, selamat petang Doktor.
Hai, hello.
Okey, sebentar tu kita tunggu dulu ya peserta masuk. Doktor apa khabar?
Good. How are you?
Saya daripada mana Doktor?
Sekarang saya punya center.
Okey.
Baru finish client.
Okey, kita tengok peserta yang mana yang ada. Dari mana je? Ana Rohana. Okey, Tengku Hasnuriana, Nirwati, Husin. Okey, tanpa membuang masa lagi, kita boleh teruskan kita punya webinar ya Doktor ya. Di sini saya ingin memperkenalkan Doktor yang dikenali Dr. Ku Kian Yong atau lebih dikenali dengan nama Dr. Hero, okey. Yang mempunyai center yang Center New Mind Brain Health Center. Okey. Dan Doktor PhD UUM Research Area Hypotherapy Expressive Art Therapy ya Doktor, dan mempunyai Master of Psychology Industrial and Organizational dan Postgraduate Certificate in Traumatic Stress Studies dan juga Master and Bachelor Degree in Psychology Field Diploma in Cognitive Behavioral Hypotherapy, Certificate in Neurofeedback ya Doktor.
Betul.
Okey, tanpa membuang masa lagi kita teruskan dengan kita punya webinar hari ini. Okey. Okey Doktor, apa maksud hypotherapist tu? Boleh Doktor kenalkan sikit?
Okay, hypnotherapy is basically kita using hypnosis technique untuk improve like subclinical concern ataupun preventive mental health. Like we can help for like improving some symptom of mental health issue during the subclinical before they become like illness. We can help to improve, for example, sleep quality, behavioral change, habit actually like improve the habit, quit smoking, weight management, even like also help for improve confidence. So it's actually more like teaching people coping skill, also helping people to somehow like having some non-clinical kind of rehab to improve their life quality using hypnotherapy.
Okay. Okay.
So,
Kita boleh teruskan doktor dengan soalan ya.
yeah,
Okay. So, what is trauma-informed practice and what are the rules of trauma-informed hypnotherapies?
okay. So, trauma-informed hypnotherapy. Maybe we can look at the next slide. Yeah, so as you can see just now, we talked about in hypnotherapy. I think a lot of people didn't aware hypnotherapy already like one of the professional under the NOS, the National Occupational Standard Skill. Hypnotherapy under the other health care related, as you can see in the previous slide. So trauma-informed hypnotherapy is more like an advanced skill of hypnotherapies. So some hypnotherapists, once they already learned hypnotherapy skill, they might want to further into other field also. Like for example, some hypnotherapy focus in peak performance, or some hypnotherapy focus on cognitive behavioral hypnotherapy. Like trauma informed hypnotherapy, basically they focus on like more like a preventive mental health, but working on helping people with some like for example complex trauma, small t trauma, those trauma which is not under diagnostic but already showing some symptom like making them feel uncomfortable. Then trauma informed hypnotherapy helping them to improve their condition, not only to prevent but also helping them to like coping, teaching them coping skill, which helping them to cope with the impact of trauma. Yeah. So trauma informed hypnotherapy actually they're working on not just a stress, but sometimes could be a prolonged stress until it already become like a trauma. Yeah. So we teaching client how to overcome it.
Okay. Okay, doktor. Okay, why trauma-informed care matters in organizational setting?
Okay. So maybe we can look at the next slide. We have another slide, right? Yeah. Let's see. So as you can see, right, in a organization, we actually not only like people only can categorize as either healthy or unhealthy. There's a lot of people actually suffer in organization in the middle, which is subclinical. They are not either having mental illness, but they are not healthy as well, isn't it? So when people in between, like yellow color here, they cannot dealing with stress. Sometimes the stress eventually also can become very traumatic, and that's why we need to actually look into this population, because sooner or later when you expose on the stress for long, it can become something very complex, even develop into complex trauma. Some people they not necessarily develop into mental illness, but they might start in a complex or developmental or complex trauma, even small t trauma, and until it become very chronic. So it's quite important for us to help them teaching coping skill before it becomes something very severe, even like they can't really work, even quit their job. Burnout. It's very common thing, right? Burnout. Yeah. So we can see the next slide. You can look at the next slide. Yeah. So as you can see, as a hypnotherapist, we actually can provide quite much of support in the public health sector. For example, through the primary prevention strategy, we can do something like a stress awareness talk or even traumatic stress awareness talk to let people know about what happened, what is happening in their life and what is happening in their body. Sometimes it could be even like psychosomatic. They have some unknown physiological response, and sometimes it could be a trauma response, but we don't know. That's why through the prevention strategy, like primary prevention, we help people to aware, so people can start to think about what kind of thing they can do so they can change. So second step is like a secondary prevention. We can help them to dealing with the stress, even trauma by learning some coping skill. Like hypnotherapy, trauma informed hypnotherapy, we teach people coping skill so they somehow can deal with the impact of the trauma. So at least they can have a better capacity to handle it. Because not all the trauma that are visible. A lot of trauma is invisible. For example, relational trauma, developmental trauma, all these trauma, they are not so visible. So sometimes people suffer in silence. Even as a trauma-informed hypnotherapy, you also can help people with tertiary prevention, which is a non-clinical rehab. Sometimes you focus on helping them to like have a better time management, dealing with their procrastination, even improve their sleep quality. That is very important for even people with already diagnosed mental illness. They also can through the tertiary support to improve their quality of life, even their work quality. That's why this is so important. We want to help people before it becomes so severe, even like handicap them. Help them to like really have something to prevent the condition become worse before it happen. Okay?
Okey. Dia dapat membantu lagi memperbaiki kehidupan harian, aktiviti harian individu yang mengalami kesihatan mental dia, Doktor.
Hmm.
Okey. Soalan seterusnya, Doktor.
Hmm.
Soalan seterusnya, why trauma informed care matters in organizational setting?
Okay, we can look at the next slide, the coming slide. So as you can see, right? Okay, next one. Yeah, next. Okay, another one. I think will be a few more slide. Then I can show the statistic. Okay, okay, next one. Okay, stop here. So as a recent study that I found in the Fabulous Health Asia Mental Health Index report, right? They found that actually Malaysia, right, we are actually the employee have a very high risk of developing into mental health issue. And interestingly, Malaysia, we are actually you can see we are number two. The first one is Korea. Second one is Malaysia. Malaysia have a very higher percentage of develop into mental health issue. But I think when I was much younger, I always heard that Japan, Korea, Hong Kong is like even worse. But now you can see Malaysia is actually quite severe. A lot of workers having the risk to develop into mental health issue. That's why it's so important for us to do something. And this survey is conducted in 2022 among 13,000 workers across 12 locations in Asia. So I would say that this is something quite serious that we really need to do something about it. Not just wait until everyone go into mental illness stage, only we do something. And the next slide, as you can see, the next slide. Okay, let's see the next slide. Okay, when you look into the detail of other survey, right, you can find that this, according to this another survey, McKinsey analysis, they found that not only burnout, depression, anxiety, symptom of distress, actually in most of the country, right, toxic workplace behavior is something that contribute to the outcome of either burnout, depression, and then anxiety, distress. So toxic workplace behavior is so common thing that people actually face, no matter you are in Japan, India, China, global. So toxic workplace behavior is really something that we really need to look into it. But when you think about toxic workplace behavior, it's actually more like something like bully, then people like some backstab, bully, all sort of like hierarchy kind of thing. All these kind of thing can be classified as a toxic workplace behavior. It's something very common, isn't it? And if you're using the traumatic stress study kind of perspective to look into toxic workplace behavior, right? Most of the time, it's actually like it can cause like relationship issue, even relational trauma. So toxic workplace behavior is something that we really need to do something about it because it impacts so much of people as you can see here. Yeah.
Okey. Um, okey. Tadi doktor ada sebut toxic workplace behaviour ya. Juga pengalaman saya sebagai kaunselor di klinik kesihatan pun ada menerima pesakit-pesakit yang mengalami situasi sebeginilah sehingga mengakibatkan mereka mengalami depression, anxiety, sama seperti yang disebut oleh doktor. Okay.
Hmm.
Okay. Seterusnya doktor, soalan seterusnya. Um, soalan seterusnya. Why does mental health matter in organizations?
Hmm. Actually, mental health, right, is something for all the employee, right? It's actually affecting not just mental. That's why in my center, we call our center New My Brain Health, because I noticed that mental health is not something like just as psychological. It's actually affect our autonomy nervous system. So, for example, when you are like your mood constantly feel helpless, powerless because you cannot control your organization culture, and you feel helpless. You can't do anything about the culture. All these things actually somehow can causing your mood right more into a hyper arousal or like shutdown, frozen state. When your body in this kind of state, right, somehow it affect your autonomic nervous system. Your body tend to go into an unhealthy parasympathetic state. The parasympathetic have healthy or unhealthy one. The unhealthy one will make you shut down. So you find that you can't really do and execute whatever thing you have. So when people in this kind of down state, right, always feel like low mood, hyper arousal, there's not any like energy to complete their task. It somehow affect their performance. Because in organization, everything is about your executive function. So imagine when you are in this helpless state because you find that nothing you can do about your organization. This somehow will create problems such as procrastination. You want to do, but you don't have the capacity to handle it. And sometimes people also can develop into hyper arousal. When it's in the hyper arousal state, right, people constantly feel anxious, anxiety. It also reduce their performance capacity because you constantly anxious, right? You might be reckless, you might actually do more mistakes. Even if you're always anxious, you also feel your attention span, even your sleep quality, everything get affected. It and become a vicious cycle. It affect your next day's performance because you didn't sleep well, you worry so much. Next day, you can't sleep well, you can't recharge. Then you find your performance keep dropping. So actually, mental health and organization, burnout, so much of connection is there. So if we just focus on people performance but don't look at their mental health, don't look at their brain health. In the end, we actually can't really solving a problem in a very deep red level, just a surface level. Through the if you let's say you choose some like extrinsic motivation, maybe you're using something like motivation, increment. All this kind of motivation could be a short-term effect, not necessarily a long-term effect because you never solve the problem in the organization, culture, whatever thing that making you down, or we didn't teach you any coping skill or even empowerment to help you to have a more stable mood state. If your autonomic nervous system is not in a very healthy state, right, you will find that all the reward or whatever, it could not necessarily a long-term effect and it can affect us. I think
Okay.
this is the answer. Yeah.
Okay. Soalan seterusnya doktor. What is trauma and what kind or types or traumatic stress in organizations?
Okay. So maybe we look at another slide. Naida, do you have? Yeah. We go into the another slide. Slide. Okay, another one down there. Okay, another one. Okay, we stop here. So you can see these two picture. One is a car accident and one is someone fall down, right? Right? It's a car accident and someone fall down. So sometimes if through this picture, we might think that a person who are having a car accident, they are more like a trauma, right? most of the time we might think that people having car accident more like a trauma. And people who just fall down, maybe we think this is more less severe. So it could be just a stress, right? But sometimes trauma happen in a context that you really need to understand the person, their life. Because let's say you see this uncle who seems like just fall down, but you don't know, maybe he live alone and then having urine acid gout and he keep falling down every day and there's no anyone support him, there's no loved one is there with him, he's very alone, helpless, and nothing much he can do about it for many years. This actually can become from stress slowly, it can become something like very a complex trauma because this person only can feel all the threat but nothing he can do and nothing in his control. This trauma maybe is more severe than the car accident just now. Because the car accident kind of trauma, maybe it's not trauma, just an acute stress response. Someone is there to help him, someone is there to support him. So eventually, it becomes something like he can overcome. It's not something that he cannot overcome, right? So sometimes it's just a stressful event. But people with trauma, they might actually expose the same painful experience again and again and again, and so helpless and powerless, like this uncle. So small t trauma, sometimes the trauma is like a bit invisible kind. It's not small means that it's a small thing, it's an invisible pain. Someone they actually experience, but they can't do anything about it. They only detect the danger, but they feel so helpless and they only can freeze or fall. So trauma sometimes happen can just because like this, from small, invisible until very chronic, complex. Okay, so there's so much of different type of trauma, but most of the time we heard about PTSD. People talk about post-traumatic stress disorder, right? Yeah, and that trauma normally the like big T trauma, which is more visible. For example, war, sexual abuse, all these natural disaster. People can witness, people can see. Sometimes it's more easier for them to get diagnostic, especially when they go into the PTSD stage. But people who are having little T trauma, for example, they get like emotionally abused, gaslighting, or they are like in long term they get the gaslighting or emotional abuse, even like emotional neglect. People don't actually understand how they feel and keep saying they are demanding, hurting them. All this kind of little T trauma eventually can become a complex trauma. And sometimes the trauma happen in our own family, our organization. And we learn to cope by acting we are okay. We fawn. Even we put a smile in our face. Look, we are okay. All this kind of thing actually suppression itself. It detect the danger, but nothing you can do. It can also from stress become a trauma one. So a lot of pain happen in our society, in our organization, but sometimes we don't even have a name for it. Even we don't have a word to describe your pain because the nature of trauma somehow make a person numb. So after you suffer in a traumatic stage for a long ride, you also numb. You can't describe your pain anymore because it's become a normal for you. So, but you still get triggered. You can get triggered sometime, and even you don't know why you get triggered. It's like you already so get used to this kind of dangerous, even helpless situation. So you become very numb living. That's why for us, right? I think we can do so much. Even by bringing out the awareness, we help people to aware they have an option, they have a way out from this numb, repetitive kind of traumatic stage. Okay? Zunaida?
Okay. So maksudnya trauma bukan saja event yang stressful tapi juga lihat pada individu punya spesifik pengalaman juga, Doktor ya?
Yeah, their context, their individual context. That's why we need to really talk to them. Not necessarily trauma must link to mental illness. Sometimes we having trauma, but we are not healthy also, and we are not having illness as well. We're just in between. So sometimes the trauma store in our body, our belief system, even change our characteristic, our personality, become like we have a lot of conflict within ourselves. So this group of people normally they suffer in silence because they can't even get diagnosed to get help.
Okay, kita teruskan Doktor
Hmm.
Okay, how the relation trauma can manifest among healthcare team members, and it was in what way?
Okay, so relational trauma, for example, let's say relational trauma. Okay, we look at the next slide. There's a slide to talk about relational trauma. Okay, next one. Okay, next one. I think behind a bit. Yeah, here. Okay, so as you can see here, relational trauma, right, refer to the consequences of abuse, neglect, even abandonment within a relationship. And this kind of relational trauma, right, sometimes it not only affecting your relationship, it affecting how you perceive yourself and share your expectation in relationship. So for example, let's say a person who are having relational trauma during their childhood, but they are so helpless because the one who traumatized them is their loved one, their parent, right? The authority. So in order to avoid the abuse, the critical treatment, the criticism, they learn to blame themselves. No matter what happened, they blame themselves. Why? Because blaming themselves, at least they still have a way out. If they don't blame themselves, they feel more helpless because it's like nothing I can do. So when people having this kind of relational trauma, when they go into workplace, right, likely they might keep blaming themselves. So when they keep blaming themselves for everything, right, they can become so anxious because everything they need to prevent, everything they need to prevent something bad happen. That made them constantly having so much of nervous energy in the workplace. And there is one form of relational trauma. Imagine another form of relational trauma. They are like their survival tactic is to blaming everyone, so they feel no shame. They don't feel so bad. As a child, blaming their everyone around them is a problem. They feel more at ease. So a person who carry this relational trauma when they go into an organization, they might actually keep blaming everyone around them. Don't take ownership for their mistake. Then they also can create a lot of conflict among their teammate, right? Because they don't take any accountability because they don't want to feel I am bad. So they make everyone bad, but then they might actually they can't grow. So people around them might suffer also. So relational trauma when they go into a like when you manifest into your career, your organization, it can sometimes become like a pain in everyone's life. Even could be this person sometimes not necessary must be a person who are like lower hierarchy. Sometimes they can be top management, right? So when they imagine they keep blaming you, blaming everyone, they can make the culture of an organization become unhealthy, isn't it? So relational trauma actually they can not just impact a person to make them feel worthless or this. In order to avoiding those pain, the worthless feeling in them, there might actually a lot of defense mechanism coming out as a trauma impact, a trauma response, which changing their characteristic, making them have certain very fixed trait or kind of personality that hurting other people. Yeah. Okay, do I answer your question?
Okay, okay Doktor. Soalan seterusnya Doktor. Um, How healthcare workers can manage their own trauma and not project to other people in their daily work. Example, patient family, and colleges.
Okay. Sorry, can you repeat the question one more time?
How healthcare workers can manage their own trauma and not project to other people in their daily works. Example,
Okay.
project to patient family, and colleges.
Okay. So I think first step is awareness. That's why if you are not aware, you don't have a choice. You cannot choose how to respond differently, isn't it? Right? That's why it's so important for us to like create some workshop like this. This is like a screening workshop. We let people aware first. But you're aware, the next step is about what can I do? What is the option I have? And that one you might need to go more in depth kind of like workshop, even course, even one-to-one session. So you learn how to cope with your trauma impact. Because trauma is not about memory. Trauma sometimes they make the so-called implicit memory become very blur. So you don't even remember you have a trauma. So most of the people with trauma, especially complex trauma, developmental trauma, they forget their childhood. They forget whatever thing that made them feel painful. But the trauma become part of them already, become like in their body, in their characteristic. So in the end, you notice that they don't know what is happening. So when they don't know, they just autopilot, repeat whatever thing like the trauma made them do. For example, if a person with like when they were young, their kid like criticized by someone, that become their trauma. So when they go autopilot, they don't want to let people criticize them, then they criticize other people first. So they become their perpetrator, the one who hurting them now become them. They keep hurting people, so they feel empowered. Then people cannot hurt them first. So in this way, they are not aware. They don't know they have a choice. They have other way to cope to dealing with the trauma impact. That's the reason now even my center we do a lot of awareness talk, even like corporate HRD corp training to teach people how to also like learn their option. So awareness, then learn your option. Then the trauma impact, I would say that can be minimized. So you don't need to solve your trauma, but you learn how to cope with the trauma impact. Not all trauma can be solved. Because sometimes trauma is a complex, a lifelong thing. Like it's very complex already. It's not something like can be ended easily. It could be and it happened and then it happened again and then it happened again. Something very become like a norm, a normal for you in your life. Okay.
Okay, doktor soalannya, adakah semua trauma bermula dari childhood, fasa childhood?
Uh, Not necessary because sometimes people actually they can also develop their trauma during their adulthood. For example, when they go into workplace, then they develop trauma. Also possible. But then if a person with childhood trauma, somehow research found that they could be more like maybe more vulnerable to have a trauma. The risk factor to develop into mental illness is higher because somehow maybe you don't have a secure attachment. So when you don't have a very secure attachment, the capacity to regulate your emotion, even your brain development, might be more vulnerable compared to the person who have a very healthy childhood. So when you go into like for example organization work, you might more easier to develop into a traumatic event, a traumatic problem because your brain somehow maybe had difficulty to regulate your emotion. Some people they can sleep over their problem. When they feel so stressful, go back, rest, recover. Next day they can continue to fight, right? But some people they don't have this ability to regulate. So when their body under stress, their autonomic nervous system shut down, When they sleep, or when they sleep, the next day wake up, their body still cannot actually recover from this psychological tension, stress, which already impact their autonomic nervous system. So in the end, they become more and more weak. That's why somehow I think even not necessarily a person must have a childhood trauma in order to develop into trauma, but childhood trauma definitely is one of the risk factor that contribute to the health problem, a lot of issue that related to childhood trauma.
Okay. Soalan lagi, is emotional suppression from childhood can also lead to relationship discard in later life, for example, at workplace with family members?
Sorry, not so. I'm a bit just a bit blur. I cannot
Or
hear.
is emotional suppressions from childhood can also lead to relationship discard in later life, for example, at workplace with family or with family members?
Yeah, definitely. Actually, when you're having all this trauma impact, right, they normally get trigger. For example, situation trigger, or let's say having a trauma, which is I always is my trauma is like, let's say when I growing up, I always need to be the rescuer for the family. When the family have any problem, I need to rescue. If I don't rescue, I will witness a lot of painful thing happen. So when I become a rescuer kind of role, right? When I go into organization, when I go into workplace, when I go into my own relationship later on, I might keep on trying to fix other people. Like I always feel like I want to fix someone, help them, rescue them. So in a way, when you want to fix someone, helping someone without other people asking you to help, it is like a control, right? I didn't ask you to help me. I didn't actually ask for your support. But you keep telling me what to do. What should I do? It's like a control. So that's why they will feel so sad. Why I trying to help everyone to help them prevent problem? Why no one appreciate me? Because this your your role, which is very helpful during your childhood as a rescuer, now is a pain. When you go into your new relationship, your workplace, keep using this way, not necessarily people find you helpful. Sometimes people find you as busybody, right? Yeah. So you are doing the right thing, but unhelpful for your new situation, your new relationship, your new workplace. It becomes something like control, busybody. That's why trauma is not necessarily a bad thing. Sometimes the trauma itself is very logical, but not helpful. Helping other people is a very logical thing. It's a very noble thing to do, but it's not necessarily very helpful for your current situation. That's why people with trauma, they're quite difficult to live in the present. They don't do things according to the present need. They do things according to what they learned in their previous life and bring over to their current life. So become a problem.
Okay, Doctor. Soalan the questions is now Doctor talk about dealing with trauma impact. How to address if we have trauma, especially for someone yang in denial?
Mm. So there's a lot of way, which is, for example, like letting them attend like our talk today is a very helpful thing. At least they have some insight. They might get some insight through our conversation like today. But also, we need to understand that people with trauma, sometimes you need to aware that people with trauma, most of the trauma issue, the core issue normally back to shame. Shame. They feel they are worthless. They feel something wrong in them. So when you actually telling them that something wrong in them, they need to get fixed. They need to get help. They actually sometimes you may trigger their defense mechanism. They might actually more feel like want to run away because they don't like to feel there are something wrong. That's why you might actually making them more defensive. That's why it's quite important for us just provide some information in a very like simple education way, even through some storytelling. Cannot be too direct. especially with people with trauma. You can't be too direct to them, telling them that they need to get help. But if they really want to seek help, then you can provide them some resource like what kind of work you can go for to seek help. But personally, I find that because most of the trauma issue having problem with their physiological issue, like for example, sleep problem, psychosomatic issue, panic attack. A lot of trauma cases tend to have all these kind of symptoms. Personally, I found that if you focus on helping them to relieve, teaching them coping skill, or giving them some solution to improve their sleep quality, to improve their panic feeling, to learn how to cope with their difficulty to relax, most of them actually willing to get help. So I found that focus on brain health may be easier for people who having the trauma issue because they won't blame themselves. Because when you focus on mental issues, sometimes they will feel something wrong in their personality and make them reject to seeking help. So we need to find out the need analysis, help them to pinpoint something that they themselves personally find is very relevant to them. For example, sleep problem or like difficulty to relax or like poor focus, concentration, procrastination. Help them to work on those life quality. Through this journey, you eventually also helping them to dealing with their trauma impact. Because not all trauma impact must dealing with trauma. Sometimes we just help them to rehab, help them to like improve life quality. Already consider like a trauma treatment. Trauma treatment not necessarily must be dealing with the past. Sometimes it's about how to moving forward. Okay?
Okey doktor. Doktor nak patah balik pada slide sebelum ni ke?
Huh? Sorry?
Doktor nak patah balik pada slide sebelum ni ke? Back to slide.
Okay. Okay juga.
Ini ke?
Okay, we can go down. It's not already passed. We can go down. See what else. Yeah, we can go down further. Okay, we can talk about this. The next slide. Yeah, there's few actually very important principle in trauma practice lah. As like you need to ensure safety. Safety not only physically, psychologically, emotionally, everything actually about safety. So safety sometimes, especially people with trauma, right? They tend to have a lot of physiological complaint or problem. So you need to ensure that the body feels safe enough first before you work on their psychological. Because the body don't feel safe, the body cannot relax. It's so difficult for them to actually using top down to process the information. Also giving them choice is very important. Let them feel like you are collaborate with them. You are not choosing what to help them, but you collaborate with them, discuss with them. Let them feel a choice. Because if we using something like we suddenly tell them you need to do this, you need to do that. Sometimes this kind of attitude or personality trait as a provider, practitioner can trigger your client who are having the trauma response also. They might feel like, hey, why you are actually controlling me? Yeah. So we really need to be aware the way we actually talking. It's like it's very important to learn some psychological safety conversation, help people know that teaching people to learn some conversation, they're helping people to feel they have a choice. Like for example, hypnotherapy, when we're learning the trauma-informed hypnotherapy, we will learn about some hypnotic skill that help people feel more in ease. We're giving them some suggestion by giving choice. We don't tell them you need to do this or do what to direct. Make it more indirect. It's more like a conversation in hypnotherapy, but in a more indirect way. So people don't feel the suggestion is too strong, it's too controlling, something like that. We can look at the next slide, the next one. Okay, so this 4R is very important in trauma-informed approach. approach. Like first is about realization, then recognize, respond, resist. So a lot of trauma therapy actually at first we focus on help people realize what is happening there first. Once they're aware what is happening, then like for example through the psychoeducation workshop and through our intervention, our like even some article sharing, once people realize, then they can start to go into recognition. Recognition can through some screening tests. Like my center, we tend to screen client brain health first. When we screen their brain health using the EEG biofeedback, expressive art therapy tool, assessment tool, is more like helping people to aware their arousal state. Once they are aware their arousal state, then we teach them how to improve their mood state rather than improve their emotion. Because we want to prevent they go into like hyper or hypo too like too strong. It's okay to go into hyper or hypo, but you need to learn how to out from that state also, like coping skill. Then we teach them how to respond. Lor. Then in a way, when they have all this knowledge, they also can learn how to resist re-traumatization. That's why trauma therapy, there's a phase model, trauma therapy, etc. In the end, we want to ensure that we actually tailor our individual treatment that's suitable for everyone. Not just a standardized protocol, but it's more individualized. Otherwise, sometimes even like hypnotherapists, helping a client to relax. Maybe it worked very well for another individual who don't have a trauma. But a person with trauma, right, when they ask them to relax, their body might misinterpret the relaxation feeling as a frozen, freeze feeling. Then they might having some very strong every reaction, even like uncomfortable feeling. It's not because I do something wrong. It's more like I didn't understand the client need. Yeah, so this is something that we also need to realize, recognize as a practitioner. So we also can respond in a way helping client to resist, even prevent the re-traumatization happen. Okay?
Kat sini ada soalan doktor. How to
Mm.
maintain trustworthiness especially when one had been betrayed or involved in traumatic life event before?
So actually, let's say a person is already been betrayed, like betrayal trauma, right? Something like betrayal trauma in the past, they're having this kind of experience before. What we can do as a practitioner is actually, I would say that even though it's limited, but we can build a psychological safety with client first. So what we can do is not through telling them, like giving them lecture. No, we really need to start from very minor thing, which is like train them to trust the body, trust themselves, from a very minor trust, slowly to make them feel really psychological safe. When they have the capacity to feel the safety, right, then they have the capacity to start to connect with people. Then when they can connect with people, more easier for them to have the capacity to dealing with this kind of betrayal feeling. So this betrayal, especially betrayal trauma, right, you really need to like not just dealing with betrayal. It's more like you're dealing with the safety feeling. How to make client feel safe again. But the safety feeling really need to come from very sub like very minor change first. First from sometimes even trust themselves first. Yeah. Okay?
Okay. Okay, seterusnya doktor, your quick win method or technique for our audience, what three things the most important tips or message for our healthcare workers in managing their own trauma so they will know easily project to their patient and colleagues.
I think we need to aware that trauma normally they happen by trigger. When you trigger your survival tactic. So when you get trigger your survival tactic, your defense mechanism they tend to I would say that could be a trauma response also. For example, a client, a patient who suddenly shouted at you, said that why you actually delay my treatment, why you didn't come on time. It made me so painful now. When actually you are not purposely late for the treatment, but because you have something, just now another patient need a support. So that's why you delay 10 minutes. But if you get triggered by client, you might actually really, really strong in belief that you've been you've been actually blamed for something that you didn't do purposely. And you think the client is really, really not reasonable. And you might feel very, very strong intensity to fight back. Even you want to neglect the client, even scold the client. So the very important thing is to aware that even your logically is correct, this person is not really not really considerate and too impulsive. But make sure you actually go away first. Give yourself at least have 5 to 10 minutes, even 30 minutes is best to wind down first before you react. Because if you can actually wind down first, even stop yourself to react first, you might actually start to go back to your calmer self. Then you can think about how to react. So a lot of people who having trauma response, the most difficult thing for them is they cannot calm down themselves. They are too impulsive. But the reason they become like this is because they don't have the ability to wind down and relax. This is sometimes training a person first, learning how to wind down, relax, remain peace, remain alone. Sometimes can be alone doing things. Sometimes they can do nothing. All this kind of physiological training to make their body can have the ability to relax is so important. Because if you don't have the ability to feel safe, feel relaxed, right? How can you regulate your emotion? How can you regulate your reaction, right? So back to the core, learning how to self-regulate first before we can actually choose what to react. And the regulation sometimes could be even bodily based. Yeah. So as Masna mentioned, we need to identify our own trauma and managing our triggers so we can help ourselves refrain from traumatization. Yes. So it's important first. You need to identify what kind of trauma impact you have first, so you have more choice. If you never really explore, you don't even look into yourself, you might actually have more projection to other people, especially when you see someone who's similar like you. So try to observe when you keep on criticize about other people behavior. Sometimes it could be a projection. You might doing the similar thing. Okay?
Okay. So it means we need to identify our own trauma and managing our triggers so we can help ourselves prevent from re-traumatize other people or affect other people. Kan, Doktor? Okay. So itu yang dikongsikan oleh Dr. Hero pada hari ini. Sangat memberi manfaat kepada kita semua dan harap semua peserta dapat manfaat dan dapat mengamalkanlah apa yang Dr. Hero telah kongsikan sebentar tadi ya. Okey. Terima kasih Doktor atas kongsian dan insyaAllah akan ada sesi kita akan datang. Jumpa lagi. Okay.
Thank you.
Okay. Kami sangat-sangat berterima kasih dan hargai Doktor sudi menyampaikan webinar pada hari ini. Okay. Okay, untuk para peserta, penilaian akan dibuka sehingga 4:30 petang. Boleh scan. Dan tekan link ya. Okey, sampai di sini saja. Okey, terima kasih doktor.
Bye bye. Bye
Bye.
guys. Thank you everyone.